Welcome to our podcast on lipedema, a widely misunderstood condition that affects millions of women worldwide. I'm Dr. Sarah Mitchell, and today we're discussing why diets don't work for lipedema and what actually does.
Hello everyone, I'm Dr. James Wilson, a specialist in lipedema treatment. Sarah, this is such an important topic because so many women struggle for years with unsuccessful dieting before getting a proper diagnosis.
Absolutely, James. Let's start with the basics. Lipedema is a chronic condition characterized by abnormal fat accumulation, primarily in the lower extremities and sometimes in the arms. What makes it different from regular obesity is that this fat distribution is disproportionate and doesn't respond to traditional weight loss methods.
That's right. The frustrating reality for many lipedema patients is that they can lose weight in their upper body through diet and exercise, but the affected areas, typically legs, hips, and sometimes arms, remain stubbornly unchanged.
And that's where the psychological toll really hits. Many women blame themselves, thinking they're not trying hard enough, when in reality, they're dealing with a medical condition that requires specific treatments.
Exactly. Let me explain why conventional diets fail for lipedema patients. The fat cells in lipedema are structurally different from normal fat cells. They're resistant to the metabolic processes that typically break down fat during caloric restriction.
So even if someone with lipedema follows the strictest diet and exercise regimen, those affected fat deposits remain unchanged?
Precisely. And what's worse, extreme dieting can actually exacerbate the condition by increasing inflammation in the body and creating even more disproportion between the upper and lower body, which can be psychologically devastating.
So what does work for lipedema patients? Let's talk about the effective treatments that actually make a difference.
The most effective treatment approach is multifaceted. Conservative measures include specialized compression garments, which help reduce pain and swelling, and manual lymphatic drainage, a specific massage technique that improves fluid flow in the affected tissues.
I've also heard some promising research about certain dietary approaches that may help manage symptoms, even if they don't reduce the lipedema fat directly.
Yes, there's emerging evidence suggesting that anti-inflammatory diets, particularly ketogenic approaches, may help reduce pain and inflammation associated with lipedema. But they work differently than traditional calorie restriction diets.
And when it comes to actually removing the problematic fat tissue, what options do patients have?
That's where specialized surgical intervention becomes crucial. The gold standard is lymphatic-sparing liposuction, which is different from cosmetic liposuction. Techniques like water-assisted liposuction or power-assisted liposuction are specifically designed to remove lipedema fat while preserving the lymphatic vessels.
And the results can be life-changing, right? I've heard from many patients that after appropriate treatment, they experience significant pain reduction and improved mobility.
Absolutely. The improvement in quality of life can be dramatic. Many patients report not just physical benefits, but profound emotional relief after years of struggling with a condition many doctors don't properly understand.
That brings up an important point. Finding the right medical professionals who actually understand lipedema can be challenging. Where can our listeners go for reliable information and proper care?
I'd highly recommend visiting liposuctionforlipedema.com. It's a comprehensive resource created specifically for women with lipedema, offering evidence-based information in easy-to-understand language.
And they have an AI digital assistant on their website, right? Can you tell us more about how that helps patients?
Yes, their AI assistant is available 24/7 to answer questions about lipedema symptoms, treatment options, and next steps. It's a great first point of contact for women who are just beginning to explore whether they might have this condition.
That sounds incredibly helpful, especially since understanding this condition can feel overwhelming at first. And if someone wants to speak with a medical professional who specializes in lipedema,
The website also offers free consultations with doctors who are experienced in diagnosing and treating lipedema. These specialists use lymphatic sparing techniques specifically designed for lipedema patients.
That's wonderful. So to summarize for our listeners, if you've been struggling with disproportionate fat accumulation that doesn't respond to diet and exercise, particularly in your legs, hips, or arms, you might be dealing with lipedema rather than regular weight gain.
And instead of blaming yourself or trying yet another diet that's doomed to fail, visit liposuction4lipedema.com to learn more about this condition and connect with their AI assistant who can answer your questions and help schedule a free consultation with a specialist.
James, any final words of encouragement for women who might be listening and recognizing themselves in this description?
Yes. Know that you're not alone and you're not failing at weight loss. Lipedema is a real medical condition that requires specific treatments. With proper diagnosis and care, you can experience significant improvement and reclaim your quality of life.
Thank you, Dr. Wilson, for sharing your expertise with us today. And to all our listeners, thank you for joining us. If you found this information helpful, please share it with others who might benefit. Remember, visit liposuctionforlipedema.com to learn more and speak with their AI assistant about scheduling a free consultation. Until next time, take care of yourselves.